Good afternoon. My name is Mariah Miracle. Thank you for joining us for the September 29th COVID-19 virtual news conference. Today, we're joined by Humboldt County Public Health Director, Sofia Pereira, and County Health Officer, Dr. Ian Hoffman. I'll start with a brief update from the Joint Information Center before we hear from our panelists. A total of 8,461 Humboldt County residents have tested positive for COVID-19 as of yesterday's report. In September alone, the county has recorded 1,350 cases with 2 days left to report, and that's an increase of about 19% from August. 55 hospitalizations and 22 deaths from COVID-19 have been reported in September. Anyone with a non-emergency call related to COVID-19 can reach out to the community information line by calling 707-441-5000 anytime, Monday through Friday from 8 to 5 p.m. We answer questions in English and Spanish. Now we'll hear from our panelists, and we'll start with Public Health Director Pereira.
Good afternoon, everyone. So our team is continuing to focus our efforts on testing, vaccination, and contact tracing in our community. While we are providing boosters at our clinics to those who are eligible, and Dr. Hoffman will elaborate more on that, we are seeing folks show up to get their boosters at our clinics. We are continuing to focus our effort to reach the unvaccinated in our community. That continues to be our best shot to get through this pandemic together. We also recently added testing to our SNAP Nurse mobile vaccination team. May have heard that there's limited supplies of rapid tests across the country. And so we have been receiving questions about where rapid tests are available, and attending our combo clinics is a good way to get the vaccine and a rapid test at no cost to you. There are currently some delays that you may have heard about for PCR test results. So please just keep that in mind if you're hoping for a really quick turnaround. We're hearing that's improving, but just wanted to let people know that that is a possibility. And if you are interested in any of our clinics or in combo clinics, you can take a look at our daily news releases that we send out. And you can also call the community information line at 441-5000. And we have staff there that can help you find what testing and vaccination options are available to you. Thank you.
Thank you, Sofia. Dr. Hoffman.
Thanks, Mariah. Thanks, everyone, for being here today. So I want to start off, just give you a brief update on where we're at with the epidemiology of COVID-19 in our community, and then touch briefly on the recent approval of vaccine boosters and how that's working in our community. So we have seen over the course of the past few weeks continual decline in case counts, which is great news because, as we all know, the past few months have been the hardest yet in our community for COVID-19. The hospitalization rates were also declining throughout the past few weeks, but unfortunately, we are seeing an increase in those hospitalizations again in the past week or so. So we continue to have both case rates and hospitalization rates that are still higher than any point that they were before August of this year. So the two previous surges that we saw in the winter and in the spring we're still at levels well above those. So while there is some encouraging news that we are coming down from this surge, the worst is not over yet. So we need to remain vigilant, and we need to continue the precautions that we've followed all along with masking, distancing, hand washing, all the things that will allow us to slow the spread of this disease and in this pandemic. As far as the boosters, so last week, the FDA and the CDC approved Pfizer booster for several groups. And so I just wanted to break that down for everyone so that they could have a better understanding of who qualifies for that booster and who should get their booster and who can and is the boosters are available to those groups. So there's everyone over the age of 65 who got Pfizer is recommended to go get a booster now. So if you're fully vaccinated with Pfizer and you're over the age of 65 and it's been 6 months since your second dose, you should go get the booster now. If you're over the age of 50 and you have an underlying medical condition that puts you at higher risk for COVID complications, and you are fully vaccinated with Pfizer and it's been 6 months since your second dose, you should also go get your COVID booster now. The other groups that they recommended could get their booster now were people under the age of 50 down to age 18 with underlying medical conditions, and those folks can go get their boosters now. And then lastly, the group of people who don't meet one of those age or medical conditions requirement, but they work in a high risk setting and they were vaccinated with Pfizer, and it's been 6 months since their second dose, those people can go get their vaccination booster for Pfizer now. We do expect Moderna and Johnson & Johnson data to be coming down in the coming weeks or months around boosters for those as well. We also know that the CDC, the FDA was given data from Pfizer early this week around the 5 to 11-year-old group, and they will be looking at that in the coming weeks. And so we hope to see potential approval coming on the line sometime in the next month for the younger age group for 5 to 11 for Pfizer. And then lastly, just say if you're in any of those groups that are now eligible to get the booster, and I should add that includes anyone who is immunocompromised and got fully vaccinated with either Moderna or Pfizer, and that group also should get vaccinated with a booster as soon as 28 days after their second dose. So any of those groups, you can go to any of the locations that are offering vaccine at pharmacies, at the local clinics who are offering vaccine, or any of our county-led clinics. So please, continue to seek out your first and second doses. And if you're, in one of those groups who should get a booster shot, please get it to help protect yourself. Thank you.
Thank you, Dr. Hoffman. Now we'll take questions from reporters, starting with Isabella Vanderheiden at the Time Standard.
Hi, thank you. I'm curious if the county is tracking what percentage of healthcare workers are vaccinated ahead of the September 30th deadline. And also, is there a breakdown by field, such as hospital workers, clinic staff, dental staff, that kind of thing?
Yeah, so that data is not collected by public health. The healthcare entities who oversee those employees are the ones who are required to collect that data, verify people's vaccination, and to implement the health order at the state level. So we are, certainly fielding some calls around how to implement those health orders. But that's not something that public health locally is, has access to that data.
Sure. Thank you for touching on that.
Any follow-ups on that, Isabella?
No, I don't think so.
Okay, great. Thank you. Kimberly Ware from the North Coast Journal.
Sorry, trying to unmute. With the potential coming online for the 5 to 11, are there any plans being made to maybe start factoring mass vaccination sites, or having that be a possibility in the coming weeks?
Kim, could you I heard the last part of your question, but could you restate it again?
Oh, I'm sorry. Turn my volume. Are there any plans with the 5 to 11 age group coming online? Are there any plans to hold like mass vaccination sites again?
Dr. Hoffman, do you want to touch on that?
Sure. And Sofia, chime in if you have anything to add. We're both very closely involved with the vaccine effort. Obviously, it's the #1 priority in public health right now. So as far as mass vaccination efforts go, we are not planning any mass vaccination efforts at this time. We're really in a different place than we were back in the winter months when we had large-scale mass vaccination efforts that were, vaccinating 500, 600, 700 people a day in those sites. We have now pharmacies all across the county who have adequate supply. They have plenty of appointments. We have more providers now giving out vaccine, and we have this mobile resource that we're utilizing through the county. So we feel that this is pretty well positioned to be able to meet the needs of all the expanded booster shots, and additionally the 5 to 11-year-olds. What I would say though is, if we get into a place where we are finding that the needs of the community are not being met, then we certainly will be looking for other solutions, which might include a mass vaccination event. As far as the 5 to 11-year-olds go, it's a difficult group for mass vaccination. We are hopeful that clinics and pharmacies and other smaller scale clinics will be able to vaccinate those groups in what might be a more appropriate setting. But if the need is there, we'll certainly make it happen. Sofia, you want to add anything to that?
Yeah, the only thing I'll just say and just really reinforce is that our community resiliency at this point is so much stronger as we've made it through this vaccination effort. Dr. Hoffman really outlined the infrastructure that we have now that we didn't have in the beginning. So there are really so many opportunities for folks to get vaccinated. We are keeping a close eye on the trends and seeing what the demand is going to be looking like, both for boosters, reaching the unvaccinated, including children. So we are looking at how that's going to impact the infrastructure, but right now we're not hitting that capacity. We're not maxing out the current infrastructure that we have. So we'll keep a close eye on it.
Yeah, one other thing I just thought of too, wanted to add in there was that, in those early days back in the early winter months when we were holding mass vaccination events, there was also one of the key limitations was supply of the vaccine. And, that's something people have asked, is there going to be a supply issue right now? And what we're being told by this federal and state levels is that there will be no supply issues at this point. So that's why, it's really going to come down to the infrastructure to give those shots. So everyone's watching very closely. If the demand is increasing and there aren't enough appointments, we'll be looking to expand the number of appointments to get those shots into the arms.
Can I ask one point of clarification?
Yes, please.
Okay. When you were talking about the booster shots, you mentioned with the immune compromise that it didn't matter if you had Moderna or Pfizer. Is that correct? Is that the only group then that really applies to?
That's true. Yes. In August, CDC approved both Moderna and Pfizer for a third additional shot of those products if you are immunocompromised and had been previously fully vaccinated with those. So, and that one is, like I mentioned, 28 days after the second dose. So it's a much shorter time period because these are really people who did not mount sufficient immune response with the first 2 shots. And that's different than the other groups who we have good evidence that they did mount an immune response, but that it might be declining over time. And so that booster would help those folks, improve their immunity. So thank you for asking for clarification on that. It's an important point.
All right, thank you.
Thank you. Ryan Hudson from the Red-Headed Black Belt.
Hi, I would like to start by asking about percentages here on local first responders and law enforcement. Do you know what percentage are vaccinated currently?
Yeah, great question again. Public health does not have access to employer level data. The data that we have access to through the California Immunization Registry is individual level data. So, again, for any healthcare entity, any business, that would really be a question for those individual entities to get that data.
Okay, thank you. And if I could follow up with same thing, but for locally unhoused populations, do we have any idea what the marker is on that? How many?
Yeah, so it's a great question. And it is something that we have been paying very close attention to reach the unhoused population. So we've had a really focused effort on reaching the unhoused population with our vaccination team. Open Door has also done a lot of outreach as well. Unfortunately, we haven't been able to acquire any, clear data in terms of what the baseline is of who we've been able to reach and how many more folks that we still need to be able to reach that have been either offered the vaccine or just, hasn't had the opportunity to be offered it yet. So we don't have great data on that, unfortunately, given the nature of the unhoused population. But it is something that we are really committed to working on. We are working with homeless service providers to provide several vaccination clinics throughout the county, specifically to reach the unhoused and make sure that they have as much protection as possible. So thank you for bringing that up.
Thank you. I appreciate that that information. And can you just elaborate a little bit? Is that happening? Is the outreach both in Southern Humboldt as well as in Northern Humboldt?
Yes, it is. We recently did a clinic. We've been working with organizations like AHA, who've been providing shower services. And so we've been providing joint service outreach and providing vaccination at those types of events. And so we're in Redway just recently, and we're continuing to provide that outreach throughout the county where our service providers are currently doing that outreach. We want to go where services are already being provided so that we're getting the most outreach.
Thank you.
I'll just add to that, in some of these meetings and outreach to homeless service providers, we were meeting with them to prepare them for the state health officer order that is requiring, vaccination for their employees. And so, we don't have like specific data. They haven't provided us numbers. A large majority of those homeless provider organizations had extraordinarily high rates of vaccination already in their group. And so they were not concerned about meeting the state health officer orders for vaccination. And a few have done sort of informal surveys of, folks who are in, say, homeless shelters, and fair number of folks in those settings were also fully vaccinated. Again, I don't have, specific numbers, and it's a really hard population, obviously, as you can imagine, to try to track and gather any larger data on. But I think the outreach to that community has been very widespread, and we have a lot of support from a great network of homeless providers in Humboldt County.
Thanks, Ryan. Austin Castro from North Coast News.
Hi, good afternoon, and thank you again so much for your time. So I want to know, of course, we're seeing reports of hospitals across the U.S. bracing for worsening staff shortages as healthcare worker vaccine mandates approach. And my question is, here in California, we have the vaccine mandate for healthcare workers going into effect tomorrow. So do you have any concerns about a potential staffing shortage for Humboldt County hospitals here?
Yeah, I'll talk to what I can about it, because again, really more of a question for the hospitals themselves. but just again, in conversations with those hospitals and with healthcare providers, while certainly there have been a very small number of people who said they would leave, an even smaller number of people who have actually left. So I think that the staffing shortages that were created from just longer term issues in healthcare around an aging workforce, around workforce development, and then the pressures of the pandemic on that workforce to, either have people go into early retirement or leave longstanding posts to go travel and take higher paying jobs that were much more lucrative, has been a much greater pressure on the healthcare system than any vaccine mandate has.
Great, thank you. And if it's okay, I also just have one more question. Of course, with the introduction of booster shots, how does having the potential for an additional shot for those who have already been quote unquote fully vaccinated affect the way you calculate who's fully vaccinated? Because of course, prior to the booster shots, either the 1-dose or 2-dose shot meant you were fully vaccinated. But now that we have the booster shot, how does that affect the term fully vaccinated and the number that we get from that?
Great question, Austin. So the simple answer to that right now, there is no change to the definition of fully vaccinated. Fully vaccinated is still 2 shots of either Moderna or Pfizer with 2 weeks after that second dose, or the single shot of Johnson & Johnson with 2 weeks after that shot.
Great, thank you so much.
Thank you, Austin. Isabella from the Time Standard, any additional questions?
Yes. Has the county identified any new variants in the county? And if so, how prevalent are they?
So our latest run of whole genome sequencing, it has been definitely delayed given the surge in cases. We didn't prioritize it because what's being seen nationally and it's across the state. But in the latest run, it was 98% Delta with a few of the other ones that we've been having here for a long time, like Alpha. So it really is very supportive of what the lab community talks about this a lot. There are our lab directors on statewide and national calls all the time. And this is just what everyone's seeing, is that Delta is the vast, predominantly overwhelming variant that is out there now. It is taking over all. And the small numbers that we see of other ones are probably from travel or just pockets of that virus, still circulating in smaller areas, but really everywhere is Delta right now. And we don't have an official update, and I don't know when we will be able to do that, other than just to say everything points to Delta.
Sure. And I guess I would just follow that with what is known about those newer variants. As far as I know, it seems like they're just not nearly as infectious or deadly as the Delta variant.
Yeah, as far as some of the newer variants that are being seen around the world, and there have been, I think a couple of cases maybe across the U.S. and again, very small numbers, are that they just don't seem to be able to take hold against Delta. So, that's about all we can say. We know there are ones out there, some that potentially hold an advantage against, reducing vaccine or natural immunity, others that potentially look like they might be more transmissible. But really the data is in what is spreading. That is the most important thing, because when we saw Delta take off, it really happened so rapidly. And so we theorize about what those mutations are that make it more advantageous, but really the the most important things was seeing how it reacts in the world and in the community. And Delta has just proven itself to be, nothing else is coming along at this point to outcompete it.
I appreciate it. Thank you.
Thanks, Isabella. Kimberly Ware, North Coast Journal.
Sorry again. So school's been back in session about a month. Earlier, there hadn't been any outbreaks connected to school attendance. Are we still seeing anything change? Is it kind of remaining steady on the school front?
Yeah, the schools, I'd say, are really overwhelmingly going great. There are, certainly cases in schools, and we certainly have seen, a handful of in-school transmission that is extremely low. Overall, the overwhelming majority of cases that we see, that we know about, that we're finding out about and becoming involved in, are students who are community transmission. They get it from their family, they get it out in the community, and then they're either picked up in the school through testing, or they're testing at home, or they're testing at a site, and then they're excluded from school, and the families let the school know about the positive, and then they alert us. So yeah, we're not seeing huge outbreaks. We're not seeing lots of schools or classrooms shut down. We're not recommending that classrooms shut down, even if they have a positive case. We're working closely with them to identify who those exposures were, keep kids in school through testing, and appropriate modified quarantine measures. So I think the other thing I'll say about it is we did see a lot of cases in the first couple of weeks, and we all kind of expected that. That's what we were seeing in other jurisdictions across the state, because a lot of the kids got COVID in the last few weeks of summer vacation, and then they came into school and those cases were caught, and now we're really seeing very few cases as we go forward. So hopeful that this will continue throughout the into the winter months, and but we'll continue to work with the schools to test and take all the appropriate measures to keep kids safe and in school.
And not really related, but we were kind of talking about the surge we're seeing in the general community in the last couple months. And there's some indication that we're kind of coming out of that surge, but we're also starting to see an increase in hospitalizations again. So I don't know if you can kind of, I know you can't predict what's going to happen, but kind of where are you seeing things going at this point?
Yeah, I think the cases are coming down, which is good. We did see a small decrease in the hospitalizations a few weeks ago. That's now back up. It's not as high as it was at its worst, so that's good news too, but it is higher than it was a week and a half ago. That's probably what we might see for weeks to months potentially. Some folks are suggesting that could go on throughout the winter and into the spring, where we just sort of have a slow taper of the case rate and hospitalizations, maybe kind of bouncing around. And but I certainly don't think we'll get back to the peak that we were at in August. I don't think there's any indications to think that would be the case, unless something big changed, like a new variant came along, or maybe vaccination efforts weren't continuing to make progress, or other policy level changes that might increase people's risk. So I think we'll see that kind of slow, steady decline, with a few little surges in between going into the next few weeks to months.
start spreading. Thank you. I appreciate it.
Thanks, Kim. Ryan from the Red-Headed Black Belt.
Hi, yeah, I'd like to follow up on the question about schools and the kids there. I'm wondering, there has been some interest in the community about adding data to the county dashboard that reflects those positive cases per campus. Has that been considered by public health? And I know that's a big ask as far as calibrating all that data, but has that been considered, and why or why not?
Thanks, Ryan, for the question. So right now, the focus of our team has been working with our school districts to prevent outbreaks before they would ever even show up on a dashboard. So that's our priority right now, is to make sure that we're providing as much support to the schools as possible, giving them the resources that they need and supporting them in their work, that we're responding to outbreaks. If there were an outbreak, responding to that, making sure that we have the right amount of staffing to support our schools. And that's really what, there's a big infrastructure around that. And so that's really where we're putting our resources right now. That's what I want. I think the community, that's what the community wants, is to make sure that the protection's happening. And that's what we're focused on right now.
Thank you. I'm wondering then, are individual schools being encouraged to make that data per their campus available publicly, say on their website, or to parents? Like, how does that work when there is a case? How are people being notified? Is it public? That kind of thing.
Well, I'll speak to the data piece of it, and then Dr. Hoffman, if you want to, speak to the second part of that question. So we at Public Health are definitely supportive of, groups and organizations disclosing their own information as they see fit. That is absolutely their prerogative. Every organization is going to have their own community to be mindful of the information that community may need. And so definitely, this is where we're at in terms of what information we're providing to the community. And definitely, if there's an organization or a school district, another entity that wants to share their own information, they absolutely can do that. Dr. Hoffman, if you want to speak to the other part of the question.
Yeah, Ryan, I think the second part of your question is more about how do folks find out if they were exposed in a school. And so the current protocols are, the school would notify anyone who was exposed in that school. And that's the same as any business is required to notify any of their employees who are exposed while at work. So there's notification systems. They determine who was within 6 feet for 15 minutes or more cumulatively, and they would send out a letter. So I'm sure many people in our county, many parents now have received one of those letters. Like I said, there have been many cases. There have been many students put on quarantine and modified quarantine. And that modified quarantine allows them to stay in the classroom while they're on quarantine, which has been hugely beneficial to keeping kids in school. So other than that, schools can notify if they have a positive kid in a classroom. If they want to notify a larger group beyond just the exposed, they have that ability to do it. It's really up to the individual school, and depends on what their capacity is too, because it takes a lot of time to do all of this notification, obviously. But we really focus on notifying those who've been exposed, who are within 6 feet for 15 minutes, talking to them about quarantine and what quarantine is, and then if that school is able to offer modified quarantine or shortened quarantine, working with the family to implement that so that the kids can be in school longer.
Okay, thank you. That makes sense to me. Quick follow-up. Can we expect to see vaccine pop-up clinics, say on elementary school campuses, when the vaccine is authorized for the 5 to 11 group?
Oh, go ahead.
Well, I'll say, we are doing vaccine efforts with schools currently ongoing, mostly high schools, because that's the eligible group. And then, if there are kids who are younger than high school, they're certainly welcome to come to those clinics. Doing, events on younger kids' school campuses, elementary school, I think is something that we are not currently planning for, again, due to logistics of vaccinating that population. So we will be looking to encourage those folks to get to their doctor's office, their pharmacy, and potentially down the line there might be opportunities for that kind of clinic, but right now that is not currently the plan.
Thank you.
Thanks, Ryan. Austin from North Coast News.
I actually already asked a question, but I do actually have one follow-up if possible.
Of course.
I was just wondering if you could speak a little bit on the death rates in the county and where we're trending in terms of that statistic.
Yeah, thanks, Austin. So that, as we mentioned early on, this has been some of the deadliest months throughout the pandemic for Humboldt County and also our neighboring counties, Del Norte especially. So we are watching it very closely. I think the changes that we've seen in deaths with this surge versus the previous surges, and say, the first surge, we saw a much older population with skilled nursing facilities being hit. Each successive wave, we've seen younger and younger folks becoming ill and hospitalized and dying from this. So in the Alpha wave in the spring and in April and May, we really saw a younger population getting hospitalized and several folks who are, in their 50s who are dying. Now we're seeing that even younger. We're seeing people in their 40s and 50s dying, many people in their 20s and 30s getting hospitalized. So yes, it has continued to go down in the age group, and that is exclusively in the unvaccinated. As far as the hospitalizations and deaths in the fully vaccinated group, those have been entirely in an older age group with people who have multiple underlying medical conditions. So this is again why that group, we're encouraging them to get a third shot because of that risk, even if they are fully vaccinated. But we are not seeing fully vaccinated people who are younger, who have no underlying medical conditions. We are not seeing that group get hospitalized, and certainly have seen no deaths in that group whatsoever.
Great, thank you so much.
Thanks, Austin. Isabella, any more questions?
No, I think you guys covered it. Thank you.
Excellent. Thanks very much. Kimberly, any additional questions?
No, I think I'm okay right now.
Great. Thank you. Ryan?
Yes, thank you.
Of course.
I am wondering, why not include the graph that we sometimes see in the daily press releases, the vaxxed versus unvaccinated, and the hospitalization graph there? Why not include that on the dashboard?
Yeah, thanks for the question. We are looking at how we present information on our dashboard. That actually is something that we're actively having conversations about. So we'll definitely, we're looking at all the different data points that we currently report out and what's the best way to visualize that for the community.
Okay, thank you. I get a lot of people asking for that specific comparison. So I feel like the dashboard is a good place for it. And I do have a second question here. So our neighbors to the south in Mendocino recently adopted a sort of color-coded system to identify local businesses, red, yellow, green. I'm sure you've seen that. What do you think about that? And looking forward into the winter months where holidays are happening, people are going to be dining out more, probably inside. What is the thought there? Are we going to see anything like that?
Yeah, so we are aware of that policy, and I've been in communication with Dr. Corin, who's the health officer there, and I think we're looking at in Humboldt County a whole host of ways to continue to both protect our community and increase vaccination. So certainly it's a novel, interesting approach. We've briefed county folks on this, in Humboldt County, and so we've made people aware. No plan right now to do anything like that here, but certainly we're watching that and lots of other approaches out there to protect our community against COVID.
Thank you.
Thanks, Ryan. Austin, any additional questions?
No additional questions. I think you covered it all.
Great.
Thank you so much.
Of course. With that, thank you all very much to our media partners for joining us and to our panelists. I'll get the recording out to media as soon as possible. Thank you all very much.